treats the small intestine. So in effect, you did get the levator because the heart treats the small intestine, the heart treats the kidney, the small intestine treats the small intestine.
Would you image, if you were using heart for the levator, would you image this as T1? So if it was the attachment set, you would be needling further up the wrist?
Yeah, it's very important. If I take a look at Kylene here, when people have these neck problems, it almost invariably extends down into the upper back. Even though they might not say they hurt here, these muscle groups extend all the way down here into the upper back. And so they're going to be tight here as well. So you want to extend your image into the wrist area and then move the needles on up the arm. I would go up about 3 inches, and you can, with the same channels, small intestine, heart, and lung. Okay? You can use the large intestine too. The large intestine treats the kidney, so you can use that too. But I would spread the image from about heart 8 all the way up about 3 inches up the forearm. And I would do that for the feet and the legs as well. If you do that, you'll have great success in treating neck problems. And as for the hip, it's the same thing. Hip pain is generally a joint problem. And there's tight muscles around it, but in most cases the tight muscle groups are there by virtue of the midbrain. The midbrain will tighten up any area of the body muscularly to protect the area from further injury if the brain considers that area injured. So most people have SI joint pain or hip pain or pain around the greater trochanter of the hip. The problem is usually in the joint. The tight muscles are like a secondary problem produced by the midbrain. It's called descending control. The midbrain will purposely inhibit the motor nerves going into the muscle groups surrounding the damaged hip problem. So the first and foremost thing you need to do is take away the pain in the joint. And for that, you can simply you can look at the person, have them put their finger on where they think the pain is the worst on their hip, and then just draw a line down the leg, and where that line hits the ankle, find the nearest acupuncture point or area to get into the joint of the ankle along that line. That will have quite a good effect. So if they feel the pain on the inside in the front of the interior of the body, they're pointing to the anterior lower abdomen, like the groin area, and they say that's where the pain is. Just draw a line down the medial side of the leg into the ankle. You'll end up around the spleen, liver area of the ankle. Needle into the ankle joint right there. 2 or 3 needles. If they hurt on the lateral side of the leg, like on the greater trochanter, or if they hurt higher up into the joint area of the hip, just draw a line straight down and you'll intersect the ankle at the gallbladder area and the UB area. Needle into UB 62 and needle into gallbladder 40 and get inside the joint there. And that will have a significant effect. The rest of your needles, you're simply using vessel relationships to treat the muscle groups. And you can expand your image, halfway up the leg. You needle from the foot halfway up the leg. That will take away all the muscle tension. But the main thing you have to do is you have to treat the joint itself. So don't forget that. Okay? So if you have any questions, you can blog me. I'll be happy to answer them. And welcome all the new recruits on our website. We're very happy to have you. And we'll do our best to help you make your clinic more successful. Bye, everyone. We'll see you next week.